let the vaccine in.
In Denver, a box packed with vials of the Pfizer-BioNTech vaccine arrives at the Colorado State Lab. It's the first installment of the COVID-19 drug that will appear by the truckload in the coming weeks. Healthcare workers who've been on the front lines of the pandemic are the first recipients.
The last 9 months feel like 9 years or 90 years. I mean, it just feels like an eternity for those folks who have to go in every day, risk getting it. Many of them have contracted it.
Okay. Kevin Londrigan, a respiratory therapist, was chosen to get Colorado's very first vaccine shot.
We're right up front with these patients. We get the worst of the worst, and we're in their rooms probably 10 hours out of a 12-hour day.
Londrigan works with COVID-19 patients 95% of the time in his job and calls this year emotionally exhausting. The vaccine represents a light at the end of the tunnel for him and many, many others.
Extraordinarily exciting and anxiety-laden at the same time.
UC Health's Dr. Michelle Barron says the unknowns about the vaccine rollout, the things she and her colleagues haven't prepared for, are what worry her the most. Conquering the pandemic, she says, is like finishing a marathon.
You're so close and you can see it and everybody's cheering and is excited and trying to egg you on, but can you get there? And we will, but not without some pain, potentially.
I think it's safe. It's had the research. It's had the clinical trials. I feel safer about coming home to my family at night.
Londrigan says being picked was like winning a radio station contest. With vials of the drug, which contained 5 separate doses each, lined up and ready, it was time for nurse Christy Ruffle to do her thing.
Hi, Kevin. My name is Christy, and I'm going to be your nurse. Can you
we should elbow bump there.
I do feel very humble to be picked to do this. So 1, 2, 3, pump.
133 Coloradans were administered the vaccine on day 1. With the Moderna vaccine just behind Pfizer in the approval pipeline, states like Colorado will have to juggle who gets the drugs and where they're sent.
We got a balance to strike here, and I know people want to move fast, right? But we have to be careful. This is just the beginning of a very long road. 1/4
of Colorado's COVID-19 deaths have come in the past month. Thousands of cases continue to be reported every day.
We want to be excited. We want to have optimism, but it needs to be tempered with the fact, as you said, rates are still very high.
Still, there's new hope in the fight against the virus.
What this means, this triumph of modern science, is that the end of the pandemic is in sight.
Henrik Sabrandi, CGTN, Denver.